Hi and welcome to the channel Love Obstetrics and Gynecology. If you are under 35 years of age and trying to conceive, well, this video is just for you. Approximately 85 to 90% of healthy young couples can conceive within 1 year or even within 6 months if they know about their fertility window. A female undergoes reproductive cycle every monthly, so she in her menstrual cycle is at different phases, and these phases are basically preparing the uterus to sustain a pregnancy. A female is not fertile for whole of her cycle. It is usually in the mid cycle, you can say a week's time, when she is at her greatest fertility potential. Before I proceed further with my video, please like my video and subscribe the channel. Your support is definitely needed. Before calculating the individual's exact fertility window, we need to have a knowledge of the patient's exact menstrual pattern. What is her cycle length? A typical cycle length is of 28 days. But talking about a broader aspect, we can have a range from 21 days to 35 days. And if the cycle length is between these, we consider the patient as having a regular menstrual cycle. We need to be absolutely sure about her cycle length because we want to deduce the fertility window from it. So if a patient keeps a record of the past record of around 6 months of her menses, that is, she keeps on mentioning on her diary or some notes where when did she had the menses, the first day of menses is noted over a past 6 months, then we get a reliable data from which we can calculate the cycle length variations and the exact cycle length. Now, predicting the day of ovulation. So in a typical cycle length of 28 days, it is 14 days prior to the next menstrual cycle. So we deduce 14 from the 28. So day 14 will be the day of ovulation. If she is having a 30-day cycle, so deducing 14 from it, we'll get the day 16 as the ovulatory day. So now finally coming to the fertility window. See, here I have a cycle length of typical 28 days. So day 14 will be the day when the ovulation would occur. So the first half of the cycle is known as the follicular phase and the next half of the cycle is known as the luteal phase. So in the follicular phase, basically many follicles, small follicles in your ovary, they keeps on growing and eventually one follicle grows big enough to ovulate on the 14th day, and then finally after that ovulation or the egg release, that follicle keeps on shrinking and becomes the luteum, corpus luteum, and the luteal phase continues. So in this follicular phase, the first 4 days we get is of the menstruation, and next on the 14th day we are going to have our ovulation. So this 14th day, 5 days prior to this ovulation, the day of ovulation and the day after the ovulation is going to be the fertile window. So from this 14th day, if we go 5 days back, that is 13, 12, 11, 10 and 9. So from the 9th day to the day of ovulation and the day after, from the 9th to the 15th, we have a fertility window in which the female is at the maximum potential for the fertility. And above this, we have the days from 1 to 8 day 1 to day 8 of the cycle. The female has less chances of fertility, and the days preceding to it, they are the lowest fertility potential. That is from the day 16 to day 28, they are of the lowest fertility potential. At the time of ovulation, a female can experience various body changes that can manifest as, you can say, increase in basal body temperature by 0.5 to 1 degree. Also, she can experience some cervical mucus changes, that is, the cervical mucus becomes quite thin and stretchy, transparent. Also, she can have breast tenderness, abdominal bloating, and slight pain in the lower abdomen or in the flanks region, or we can have some slight spotting, mid-cycle spotting episodes. Also in the market, LH kits or the ovulation prediction kits are available. these are basically on the principle that the luteinizing hormone increases in levels before the ovulation occurs. So before the ovulation, we get to know that the ovulation is going to occur. So in these LH kits, basically we take the urine sample, and that urine sample will predict the LH levels in your body. So when the test comes positive, the urine test of LH kit comes positive, the ovulation is going to occur within the next 24 hours and almost within the next 48 hours. So the next 2 days preceding to the LH surge are important if you want to conceive. So knowing the cycle length, the fertility days, and knowing about the signs that you're going to ovulate, and using the ovulation prediction kits, you basically get to know that this is the time of your maximum fertility, and that is the time when you should go for the coitus to achieve or conceive a pregnancy. So this was all about the ovulation prediction and the fertility days. If you like my video, please do like, subscribe and share the channel Love Obstetrics and Gynecology. Thanks for watching.